Assalamualaikum. For this first question, patient complained of intermittent pain of his left shoulder, uh, occasionally referral pain to the upper part of his arm, and it begins about 2 weeks ago. And then he complains unable to hold a 5 kilo dumbbell, and stiffness and soreness at the lateral side of his left shoulder, in the morning and at night after work. And then he also have difficulty putting on jacket, brushing his teeth, and combing his hair. Those activities causes him pain. And then he also complains that he can hear cracking and popping sound coming from the left shoulder during swimming activity. So for this patient, I'm going to assess him with the hand behind back assessment, which I'm going to demonstrate first. So first, okay, you are going to lift up your left hand, and then can you please see what I'm doing first?
Yeah.
And then lift up your left hand and bring it upward as far as you can. If you experience any pain, let me know, and I'll assess it later. So first, hand behind your back. Okay, try to move it upward. Does it cause any pain?
Yeah.
Pain here?
Yes.
Alright, very good. Thank you. And then, because he is experiencing pain, we just want to compare. You can see that he's supposed to be able to hold his wrist a minimum up to his T10, but if he unable to do, if there's a restriction in the movement or there is pain, we need to compare with the good side, so that we have to eliminate whether it's is it his normal movement or is there any problem. So can you please do on the right side? Okay. No pain, yeah?
Yeah.
Okay, very good. Okay. So again, can you please perform the hand behind back exercise for your left hand again? Okay. Upwards. Pain?
Yeah.
Okay, hold the position, yeah? So while he is doing this, we can assess if, okay, first and foremost, we ask if there are any pain, and he said that there's pain. Pain means there's antalgic pain. And then while performing it, we have to observe his scapula also. Is it winging or downward rotated? Because winging of the scapula indicates weakness of the serratus anterior muscle. And then if the scapula is rotated downwards, it suggests there is a tightness in the levator scapula and rhomboid, and then also weakness in the middle trapezius and the lower trapezius. So from the lateral view, we also observe his humeral head. If there is a if the humeral head there's a forward protrusion, it indicates there's a tight structure in his glenohumeral capsule. So for this patient, might indicate that he has a rotator cuff impingement syndrome, and it can be confirmed further with another test specifically for the impingement. For the second question, patient complained of intermittent pain at the right knee, and then upon palpation, we found that there is a tenderness behind his knee, and then he complains that recently he experienced no pain while resting, but the pain will aggravate when he kicks ball. So the kicking motion is a extension of the knee motion. So for that, we will perform an assessment called alternate knee extension with ankle dorsiflexion for this patient. So first, what I want you to do is, okay, you have to lift up your knee, straighten up your knee and pull your ankle forward. So we want that motion. So we are going to perform on both sides first. Can you please do on the right side? Okay, very good. Down. Okay, on the left side. Okay, very good. Okay. While doing it, do you experience any pain?
Yep.
When? Where is the pain?
Down here.
Okay. When you are pulling up your leg?
Yep.
Okay. So first we already checked the range of motion. Now to confirm it, because to further investigate the knee, I want you to lift up your leg again. Lift up and lift up your ankle and hold for 5 seconds. Alright? Okay, down. Okay, there was pain, yeah?
Yep.
Alright. So while he is extending his knee, what we need to observe is if there is any abnormal movement of his knee, if there is a medial rotation of the knee while he is performing the extension, it could suggest a tightness of his distal hamstring. And if lift up your leg again. Okay. Okay. And if there is a reduce in range of motion, it also indicates there is tightness of his hamstring and weakness of his quadricep muscles. If he is unable, okay, while he is performing this, he needs to be in an upward, he needs to sit up straight and not slumping like he did just now. So while maintain this position. Okay, don't hold your breath, and then lift up your leg again and your ankle. Okay, do you feel that? Don't slump. Okay, do you feel there's more pain or restriction?
Yep.
Okay, down. Okay, this confirms that he's having tightness of hamstring and weakness of his quads, and because of that, because when he performs the extension with an upright sitting position, his range of motion reduces. We need to confirm it with another test of to relate his back muscles and his knee muscles. So that we will do another assessment, which is the bridging assessment. Oh, and another one. If he is unable to fully dorsiflex his ankle, this also indicates a tightness in his calf muscles. For bridging test, okay, I'm going to assess this patient first in supine lying and then asking patient to perform the bridging test. So for bridging test, I need you to bend both of your knees up. Okay, what we are going to do, please don't hold your breath. Okay, don't hold your breath. Breathe as normal. What I need you to do is, in this position, lift up your buttock. Up and down. Okay? Do you feel any pain?
No.
Okay. Okay, this time, up and hold for 5 seconds. Wait, belum lagi. This time, up and hold for 5 seconds. Okay, 1, 2, up. Alright. 1, 2, 3, 4, 5, and down. Okay. From the bridging exercise, the bridging assessment, what we need to assess is his lumbar, his spine should be in a neutral position. Okay, again, one more time. Up. Okay, it should be in a neutral position and without any pain. So 1, 2, 3, 4, 5. Very good. Down. Okay. For progression, first we need him to put both hands on his shoulder. Breathe as normal, yeah? And perform the bridging exercise. Alright? Up. 1, 2, 3, 4, 5. Very good. Again, we need to observe his spine position and make sure there is no increase in lordotic curvature. The spine needs to be in a natural position. Okay? Do you experience any pain?
No.
Okay, very good. So for the next progression, we are going to do the single leg bridging. Single leg bridging means that you wait, kejap. Lift up your buttock. Okay, and then put one knee up. Okay, knees should be aligned at parallel. Okay, and hold 1, 2, 3, 4, 5, and down. Also, spine needs to be in a neutral position, and thighs has to be parallel, as in his knees has to be parallel to each other. Okay, again with the other knee, up and up. Okay, maintain this position for 5 seconds. 1, 2, 3, 4, 5, down. Okay, susah sikit
Yeah.
Alright. Again, we have to observe his spinal neutral position. Okay, the next one, I need you to put one knee, one leg up to my shoulder. Okay, and you are going to perform the bridging. Okay, 1, 2, 3, up. Okay, make sure that the patient's spine is in neutral position, no increase in lordotic curvature, and okay, down. And if patient is experiencing any cramping, it could indicate to tightness of his hamstring. Okay, repeat with the other side. Okay. Okay, put your leg up to my shoulder. Alright. Knees parallel to the other one. Okay, and up, up. Okay, 1, 2, 3, 4, 5, 6, 5. Down. Very good. Okay. So thank you.